I did. Yes. Morning.
I'm not seeing it show up on YouTube Live. Are you seeing it on your end?
Mm-hmm. Linda, come in.
Okay, I do see it now. Tracy, you do have it on, you need to switch it to speaker view instead of gallery view.
Can you see it on YouTube Live now?
I can you switch to speaker view instead
Yes,
of
sir.
gallery view? There you go. All right. I'm turning off YouTube Live because it's on a delay and it's talking back to me. I have 229.
So are we good now, Sean?
I think so.
All right, wonderful.
You can start whenever you see your clock turn to 2:30.
You've got something going here. What do you have? You've got YouTube open.
I have to have YouTube open.
Well, then mute it.
So are we good now, Sean?
No, see, because you're going to hear yourself.
Where is it?
Wherever your YouTube is.
I'm getting some feedback, Sean, so I'm looking for YouTube to maybe,
It's probably, does anyone else have a computer on in that room?
yes.
That's probably where the feedback's happening.
I'm getting some feedback, Sean, so I'm looking
It's on your desktop.
YouTube to maybe.
Now, see, go here and mute that. No, that's it, but mute that.
Are you still getting feedback?
I think I've got it now.
All right, I've got 2:30 if you want to start.
Okay. All right, I want to say welcome this afternoon, everyone. I am Tracy Aaron, Health Education Director at the Lake Cumberland District Health Department. We are having the call today for the community members to get updates from the health department on COVID-19. We have a panel of our executive team staff members here at the District Health Department that will be answering your questions. And those questions were submitted from community partners as well as radio stations and news stations across our 10 counties. I do want to say we hope to be we are planning on hosting these meetings weekly at 2:30 via Zoom, 2:30 Eastern Daylight Time. So I encourage you all to know that, be aware of that, and we will share updates on a weekly basis. For the meeting, I ask you all to, I think I've muted everyone, but if you haven't, please mute yourself. If you do have questions, you're going to see a chat box at the bottom of your screen. And in that chat box, you can type questions, and there is someone going to be watching that box throughout the call or the meeting today. And we hope to answer those questions. Also, at the very end of the meeting, I will open up for questions. So I'm going to start out, and I'm going to turn it over to you, Mr. Crabtree, and he's going to give us an overview of COVID-19 across the Lake Cumberland District.
All right, I like to always begin by pointing out what our main communication objective is we're asking people to please observe the social distancing recommendations, staying at least 6 feet away from people. Don't go where there's crowds. Make sure you're washing your hands correctly and often. When I say washing your hands correctly, I mean to get them wet. Use soap and lather up for about 30 seconds, front of your hands, back of your hands, between your fingers, and then rinse off. Most people do not wash their hands correctly. So please observe those recommendations for social distancing and so forth. I have noticed that this morning in Lexington, they have changed their strategy from containment to mitigation, meaning that they consider the COVID-19 to be substantially circulated in their community, and they no longer see the point of doing contact investigations. Now, there's two things we do when we get a confirmed case. We do what's called a case investigation, where we interview the person who's positive, and we gather a lot of information. Part of that is close contacts. The next thing we do is called contact investigation. So at some point when the virus is considered to be broadly circulated in the community, doing contact investigations becomes sort of futile, and we just back up and focus mostly on the mitigation, the positive social messaging about just assuming everyone around you has it. So try to avoid people, stay 6 feet away from people, don't touch your face, cough into your sleeve, and those kinds of things. Across our district right now, we have 5 cases in Pulaski. 4 of those are on self-quarantine. 1 of those have been released from self-quarantine, has recovered. In other words, we have 1 case in McQuarrie that we know about right now that is self-quarantine. And we have 3 cases right now in Wayne County. 2 of those are in the Lake Cumberland Regional Hospital. 1 of those is on self-quarantine. I've been speaking with the hospital administrator at Lake Cumberland ever since we had our first case in Pulaski. I have every confidence that they're doing everything within their power to keep their facility safe and their employees safe and their patients safe from COVID-19. In fact, I believe they put out some sort of a media release this morning, probably around 10 or 11 o'clock. I've not seen that yet, but I understood that they were going to do that to reassure the public that they're taking every precaution. We are aware that the situation, one of the confirmed cases in Wayne County was an employee at Tyson, or is an employee at Tyson in Clinton County. We are aware of that. We have contacted their corporate leadership. We're planning on doing a news release at 4 o'clock Eastern time, 3 o'clock Central time over at the Clinton County Courthouse to talk about what the Tyson Corporation is putting in place to protect its workers. We have reached out to those cases in Wayne County. We're getting the information, we're working on contacts and so forth. So we are aware of the situation and we are working it. One bit of good news about the factory, Tyson, those employees, it's a sterile environment. So the employees do wear personal protective equipment, which may have helped us out there in that situation. If anyone feels like they need to be tested, or if they want more information, please go to our website at Lake Cumberland District Health Department. Just Google that. You'll find us. Every resource you could possibly want at your disposal is there. There's self-assessment tools. There's all kinds of information about keeping yourself and your family safe. The state's hotline is 1-800-722-5725. You can call that for general COVID-19 questions, 1-800-722-5725. So use the number and our website before you seek your information from other sources. If you think you've been exposed and you feel like you need to be tested, our instructions are call your medical provider before you just show up. Make sure that they are testing, that they have test materials available. Let them screen you over the phone. Make sure that you're a candidate for testing before you just go over there to be tested. A lot of people are going to want to be tested. The more this spreads in our communities, the tests are limited. We're still trying to preserve those as far as we can for the higher risk exposures or higher risk people that we would want to look at. I think, Tracy, that's all I have in the way of updates. So if you want to, we'll turn it over to Dr. Wayman and let her read and answer the questions that she received.
Thank you, Mr. Crabtree. And I am going to turn it over to Dr. Wayman right now.
Is this all set up?
It's all set up for you.
Okay. Hi, this is Dr. Wayman. I'm Medical Director for the Lake Cumberland District Health Department. I have the questions which I have written the answers to, and I will just read them and then read the answer. So the first question is, what is the time frame for testing to results? That usually depends on the lab, but it's somewhere between 48 and 72 hours. Greatly dependent on how quickly the specimen can arrive in the lab. The second question was, if I may summarize, the symptoms over the different ages and why some are severe and why some are not. Symptoms are not necessarily different at different ages. However, children have generally had mild disease or have been asymptomatic. Young adults may have mild, moderate, or severe disease, but generally speaking, they are less likely to have severe disease compared to older adults. Severe disease manifests as shortness of breath requiring oxygen and perhaps ventilation in a hospital. Moderate disease is flu-like, fever, aches, dry cough. Mild disease may be present with or without fever, perhaps sore throat and cough. People who are considered low risk for severe disease because of age may be high risk because of comorbidities, such as chronic obstructive pulmonary disease, heart disease, diabetes, asthma, hypertension, immunosuppression, etc. Question number 3. What are the symptoms of the disease? The most common symptoms are fever, cough, and shortness of breath. However, there are some less frequently seen symptoms, such as sore throat, aches, headache, fatigue, and rarely diarrhea. Notably also is the fact that some people are totally asymptomatic. How much does it cost to be tested? We have found that somewhere between $50 to $150 is what may be charged. I think health insurance should pay, and I have heard lots about how this should become free at some point. The state lab does not charge anything. Which labs in Taylor County do healthcare providers use? They use the Department of Public Health, LabCorp, and Quest, and I'm not sure of any others. The next question, if someone had direct contact with a person who was tested and is awaiting results, what should they do? They should become quarantined until results are available. If these results are positive, then that person becomes a contact and should remain in quarantine for 14 days. Question number 7. If an employee of an essential business has been in contact with a confirmed case, what steps should the business take? The contact is at this point not infectious, so nothing needs to be done immediately. However, that contact needs to quarantine for 14 days. If that contact then becomes symptomatic, then the health department would investigate and give recommendations to the business. Each case will be different depending on the timing. The now exposed contact needs to be quarantined for 14 days. Which healthcare facilities in Taylor County have the ability to test? Many primary care providers can collect nasopharyngeal specimens for testing. These are then sent to a private lab or to the state lab. We do not have a list of these sites. Testing is also dependent on the availability of testing kits, which are sometimes in short supply. 9, do all of these healthcare facilities have to report to the health department? All health facilities and labs have to report positive results to the health department so that we can monitor cases and contacts. How many tests have been done in Taylor County and which medical offices offer these? This is unknown to us as pending tests are not reported to public health, only positive results. Next question. How far off does widely available drive-through testing seem at this point? I'm not sure of these results of this. However, discussions are ongoing at the state level. Next question. What steps do frontline healthcare workers take to protect themselves and their other patients when patients with COVID-19 have symptoms? What difference does call ahead of time make? Calling ahead is very important as it can allow for screening of the patient for symptoms and exposure. Also, it can prepare the clinic to accept the patient, make a room available for testing, and allow the provider to don PPE, personal protective equipment. Furthermore, patients can sometimes be tested in their own vehicles so they do not have to contaminate the clinic. Frequent disinfection of clinic surfaces and doorknobs is one way of keeping the clinic safe. 13, in what ways does COVID-19 spread? COVID-19 primarily spreads through respiratory droplets when patients cough or sneeze. These droplets are large and wet, and they generally fall to the ground within 3 feet of the sneeze or cough, and occasionally up to 6 feet. Hence, that is the social distancing distance. These do not get suspended in the air unless they are aerosolized in certain procedures which generally only occur in hospitals. And at that time, N95 masks are required. Surgical masks are effective to prevent droplet contamination and can be used by the public. The virus does survive for hours to days on different surfaces. Therefore, frequent sanitizing is required and frequent hand washing with soap and water or alcohol sanitizer. Next question, what are the main questions asked to determine whether or not someone should be tested? Usually we ask if that person has been a contact to a known person with COVID-19. Have they traveled anywhere? This can help us assess their risk. And what symptoms do they have? Also, what high-risk comorbidities they may have. Next question. If you test positive, how many days are you asked to quarantine? How far back does the health department go when retracing someone's steps to figure out who they've interacted with? Persons who are at home with COVID-19 are isolated until at least 3 days, 72 hours, have passed since recovery, which is defined as resolution of fever without the use of fever-reducing medications. and at least 7 days have passed since the symptoms first appeared. The health department home quarantines all those exposed from 2 days prior to the symptom onset of the case, and they remain so for 14 days. Next question. Should unnecessary travel out of state or out of town be discouraged? Absolutely. The governor has advised all citizens to stay at home, if at all possible. Since we do not have a vaccine, the only way to prevent spread is not to connect with people who may be infectious, even if they have no symptoms or may have mild symptoms. People can transmit this disease 2 days prior to symptom onset. Hence, the only way to prevent spread is to shelter in place. Some counties are said to be collecting specimens for testing inside patients' own car. Why is that the case? Is this happening in Taylor County? This prevents contaminating facilities and can streamline testing. However, we are not aware who is using this procedure. I am going to skip question 18 for later.
Do you want to break or maybe answer something?
Okay.
So Dr. Wayman is going to take a break for a few minutes. Amy, Amy Tomlinson, our preparedness manager, has some answers to some questions that were submitted.
Okay, guys, this is Amy. I'm the preparedness manager, like she said. So some of the questions that fall in my realm were, how far off does widely available drive-through testing seem at this point? Of course, anything like that would be an estimation. I'm hearing anything from, next week to a couple of weeks from now. It would just be purely a guess at this point. We are planning for it daily and trying to get all of our resources together and people in place to make that happen as quickly as possible once those test kits and resources are available to us. So I don't have a definite date. I wish I did. We anticipate that even when that does become available, we will still be doing some sort of screening process on the front end that would pre-screen people and identify the ones who would need those tests. It wouldn't be something that we could just open up for anyone in the county who wanted testing to be done. It'll still be prioritized based on symptoms and risk factors and things like that. The next question was, one of the biggest concerns is that we will see a surge in critically ill patients that will overwhelm our local hospitals. And that is a concern. I guess the question implied, are our hospitals ready for such a thing as that? And I will just say all hospitals in our region have surge plans in place, and they've had those in place for several years. They will implement those as needed, and those plans are most likely scalable, so they can ramp up to the appropriate level as it's needed. There's also a regional healthcare preparedness coalition in place for the 10 counties, and that is a coalition of representatives from all healthcare facilities, EMS agencies, hospitals, dialysis centers, home health, emergency management, all sorts of preparedness type related people who get together and plan and train and exercise together on those plans. So that coalition can help work closely with those facilities and identify any resources that they need or gaps, where they're lacking in a certain area. They can move resources around and move assets into place to assist facilities who may be having difficulty with supply chains or vendors or whatever the case may be. The next question was, how does having a positive case in the district impact LCDHD's operations? So the health department, once we had our positive case, the first case last week, ramped up considerably. We had already activated our department operations center to, I think, a level 3, which is limited activation. We immediately went up to a level 2, which is enhanced activation. And as this is progressing, it's pretty much almost full activation at this point. I mean, there's very few of our staff who are not reassigned to some other role or in some sort of response capability. A lot of our efforts before the first case was announced last week was pre-planning, trying to make sure resources were in place and getting things together, some public information, gathering information from partners in the community, that kind of thing. And then now, since then, we have been, a lot of our medical staff who were not necessarily involved on the front end are now fully involved in contact tracing and case investigation and tracking these individuals who are confirmed cases and seeing where they've been and who they've been in contact with and all of that. So that is a huge response now as far as our health department staff are concerned. The next question was, is there an expectation that every county in the district could see confirmed cases of COVID-19? And will LCDHD have the personnel and equipment necessary to deal with cases appearing simultaneously around the district? At some point, we do completely expect that there will be cases confirmed in every county in our district. I think it's just an eventuality that we're looking forward, I mean, not looking forward to, but we expect to happen. When that occurs, LCDHD staff will definitely be stretched thin. The way that we are handling contact investigations and case investigations now is probably different than what that's going to look like at that point. Some point it will have to scale back a little bit, and we will just have to get some public information and messaging out there that says this is in your communities. There are confirmed cases out there. We need everyone to take precautions and treat it as if it's there, as if the person next to you may have it, those kinds of things. Take precautions, which is what people should be doing already anyway. But that will definitely be something that we'll adapt to as we proceed. The health department has limited staff across our 10 counties, and they are doing the very best that they can. And right now, because we don't have cases in every one of our counties, we're able to pull staff from other places to assist staff in the places where it is heavy case work right now. And as those cases increase in other counties, that won't be possible. So the next question was, how much coordination does LCDHD have with neighboring health districts? We are in frequent contact with our neighboring health departments, always looking for ways to partner with them and share resources and information. So, and then that's also true of our border counties across the state line, like for down in around Tennessee. The McCreary County case that we had confirmed yesterday, I think it was, I made contact yesterday with the Tennessee Department for Public Health and shared information with them related to that, just because it's a border notification courtesy that we do, that we have a case in our county, and as we move forward, if anything should pop up that you need to be aware of, we're going to make you aware of it. So we have those relationships in place, and we share information back and forth between health department districts in Kentucky and also across into Tennessee. The next question was, how does stopping elective surgeries help in the fight against COVID-19? And the answer to that, I think, would be that one of the biggest advantages is it helps to conserve PPE, which is at a premium right now. So personal protective equipment, gowns, gloves, face shields, masks, all those things that are being used on the front lines. By not doing those elective procedures, that makes more of that resource available to other places that is needed in their facilities. But it also may allow staff in those facilities to be reassigned. So doctors who may have been assigned to a surgery or nurses or whatever could be pulled then to assist in the response and in the efforts in those facilities. I think my last question was, when is testing going to be more readily available? And I think I kind of touched on that with my first question also. I wish I knew. I really do. I know that resources are being rerouted and made available to support testing as widely as possible, just as soon as they're possible. But like I said, even though it may become available at some point and we may schedule and offer drive-through testing at some point, which we're planning for, those would still be done by some sort of a screening method ahead of time. It's not going to be open to the public anytime soon as far as that goes. I think the rest of these questions that I'm looking at are for Mr. Crabtree.
All right, well, I don't know where those questions are. I may not have the right list. Would you read them to me?
Sure. When a positive result is posted, is it always reported as the county where the person lives, or is the county where they were tested used?
As far as I know, the cases are reported in the county of residence.
Yes. And it says along those same lines, if a person is tested outside of their health department district, is the result reported to the district where the test is done or to the district where the person lives? And that would be the same answer. It's
That is
reported
correct.
on the county of residence. The other question here is how many people have been tested in each county? And I can probably answer that, Mr. Crabtree, if you want me to, but
Well, I can answer it. I mean, in the beginning of this, all the tests were forwarded to the state labs, so we were being made aware of everyone that was being tested and what the results were. Since the private labs have come on board, they're not required, or the doctor that's ordering the testing is not required to tell us when someone is tested. They're only required to tell us if it's a confirmed case. So we really don't know how many tests are being done. On the State Department for Public Health webpage, they do have a graph or a chart which estimates how many tests are being done by county. So you can get some idea from the Department for Public Health COVID-19 page. They do have a chart for that.
I think that chart on the webpage that you mentioned, Mr. Crabtree, too, is mostly just testing that's done at the state lab. So those numbers are probably significantly smaller by county than what's actually going on locally, because so many local providers are now doing private lab testing. So those numbers, I'm assuming, are significantly higher than what's on the state webpage.
Yes.
The last question that I see here on my list is, does LCDHD or the state of Kentucky have models of a best case, worst case scenario? And if so, what all needs to be done to reach the best case scenario?
Well, the model is that this is a virus that's going to spread very broadly, regardless of our best efforts. Our best practice right now, what we're trying to achieve is what you've been seeing about flattening the curve. Trying to make sure we slow this down enough through social distancing and not working if you're sick, trying to slow it down enough so that there aren't too many people getting sick enough at one time and needing hospitalization, that the number of sick people exceed the hospital's ability to be able to appropriately process and treat them. So the best strategy is flattening the curve. As I've been saying, our citizens are our best asset, and our citizens are our biggest liability. They're our best asset if they will follow the recommendations so that we can flatten that curve and slow the spread of it and prevent how many people are needing more intense care at once. They can be our biggest liability if they're ignoring those things. We've already seen instances in our district where people have disregarded our advice and they have spread it amongst people at events that they shouldn't have been at because they weren't supposed to be gathering. One other thing I will say, Amy, it might be helpful to the media if at the conclusion you will ready out to all the media these questions and answers, so they'll have that. Will you do that? Okay.
I will. Hopefully, I sent this email or this notice about this webinar today via ReadyOp. So hopefully you all are getting our ReadyOp alerts and messages that we're sending out. So I will definitely share these answers in writing with you to these questions that we've provided.
Yeah. One thing I will add is, we are really being inundated with phone calls and emails and social media messages about businesses that are not in compliance with the social distancing rules. And people get very frustrated if we're not responding right at that instant. There's a very limited number of us that are doing a very great many things right now, and we're doing the best we can to issue guidance and cease and desist orders or whatever needs to happen when those situations come up. We are doing the best we can, just like everybody. We have a limited amount of people to do the work, and we've had a lot of work dropped on us all at once. So we are doing our best. I see some questions over in the chat, Amy. One says, with yesterday's announcement of a 20-year-old female being treated as a positive case in McQuarrie County, coupled with the governor's address yesterday where he mentioned some young adults partaking in a coronavirus party, some people have jumped to the conclusion that the patient here was the one at the party. Is there any way to address this and either confirm or deny? I don't think that's the case, but I can't confirm or deny.
I don't think that's the case either, Mr. Crabtree, mostly because we're still treating the McCreary County case as a presumptive positive. It has not been, I don't think it's been confirmed through the state lab, and I don't think the governor has even announced that one yet that I was aware of. Did I miss that?
Not that I know of.
So just for my benefit, make sure you share what presumptive positive is, Amy, if you don't care.
Okay, a presumptive positive for our purposes is one that has come through a lab report to us at the health department. We then send those up to the state lab and make them aware of it. And so there's another layer that it needs to go through to be a true confirmed. But we treat all of these lab reports that we're getting as positives. As far as I'm concerned, and as far as our nursing staff, I think are concerned, we're doing all the case investigations and everything just exactly as we would as if the state lab contacted us and gave us a hard confirmed case.
Thank you. Thank you.
So these
Tracy, are we-
presumptive positives, I guess I should say, I've come through commercial labs. I don't know that I said that clearly, but it's done through a private provider and didn't go through the state lab. And so it's through a private lab at this point. And we have the lab report on those, but it's not been through the state lab system yet and been through their process.
Tracy, are we ready to allow the media to unmute and ask questions?
Yes, I think so, Sean. So if there are individuals out there who want to ask questions, let's do it by county. Is that fine with you, Sean?
Yes, that'll be fine.
Okay, so Adair County, is there anyone in Adair County that has questions? So if you do have a question at the bottom of the Zoom's platform, you're going to see mute over in your left-hand corner.
Yeah, you may have to wiggle your mouse on the screen to get that toolbar to pop up.
Okay, thank you, Sean.
Or you can type your question in the chat.
Okay, so I don't see anyone from Adair, anything popping up. What about Casey County? None from Casey. What about Clinton County? I have one on here, Sean, it looks like, and it says, what are your recommendations for pregnant women? So Dr. Wayman, do you want to answer that one for us?
It has to be a bit more specific.
Okay, so whoever asked that question in the chat box, Dr. Wayman asked that you be a little bit more specific in regards to that question.
I saw that question earlier and I looked on the CDC website and there's specifically a link for recommendations for pregnant women. I copied their information and pasted it on my paper here somewhere, but rather than me reading all of that, I can just say, if you'll just go to the CDC COVID-19 and look at high risk, one of the categories under that is pregnant women. Not that they're necessarily high risk, it's just there's some recommendations for them. I found that it says risk to pregnant women. It says, we do not currently know if pregnant women have a greater chance of getting sick from COVID-19 than the general public, nor whether they're more likely to have serious illness as a result. Pregnant women experience changes in their bodies that may increase the risk of some infections with viruses from the same family as COVID-19 and other viral respiratory infections, such as influenza. Women have had higher risk of developing severe illness. It is always important for pregnant women to protect themselves from the illness. And then they recommend the standard things: cover your cough, avoid people, clean your hands, and so forth. Dr. Wayman, do you have anything to add to that?
I think you're absolutely right. I don't think, from what we've heard from China, that pregnant women were at higher risk for complications. And then certainly their newborn infants can be breastfed, because that helps transfer antibodies from mother to child to protect the child. And that's about all I know. But obviously everybody should be trying to protect themselves from the spread of this virus.
This says, I wonder, let's see, there hasn't been any comments by the governor regarding suggestions they work from home if possible. I'm assuming that's regarding pregnant women. I wondered if there were recommendations for working from home. Well, just in general, anyone that can should work from home. If you do have to go into your work, you should observe social distancing. If you're at a place that isn't observing social distancing, you need to have a conversation with your management to ensure that that happens. If they will not do that, alert us, and we will try to make sure that happens, all the way to the point of going to the county attorney and getting some charges filed. Now, we don't want to have to do that. We hope people will just observe the rules and be cooperative, but we will do what we need to do to make sure businesses are playing by the rules. Says, what's the status with hotels and motels and boat docks? Are they supposed to be closed? Is Stuart around?
He's here in the room with me. I'll let him use my camera.
All right. Stuart, let them know who you are.
I'm Stuart Spillman, the Environmental Director with the Health Department, and we are the ones that's been also tasked with the enforcement of the governor's orders. So far, we haven't had any orders directly about marinas. Now, what we have had orders about are the stores and the restaurants that would be on marinas, mass gatherings on marinas. But as of this time, if a person was just going to go out and get on their boat, there's no order against that.
Tracy, I don't know what county you got to in your go around.
I am on Cumberland County. Are there any questions from Cumberland County? Excuse me. What about Greene County? I'm going to let you run from Greene County, Sean, because I'm going to have to walk out of the room.
Any questions from Greene County? What about Macquarie? Pulaski?
Hi, I do have a question.
Yes, could you identify yourself, please?
I'm Carla Slavey with the Commonwealth Journal.
Yes, ma'am. What's your question?
Could you explain a little bit about what you mean when you say a patient has been cleared?
That means that they're no longer being asked to self quarantine. That means they've been quarantined long enough and symptom-free long enough that we feel they're no longer in any threat of having the disease. Laura, you might clear that up a little more if I didn't say that correctly.
You did. That means the patient has been 3 days fever-free without any fever-reducing medication and 7 days from symptom onset.
All right, thank you, Laura. That was more detail than I had, so good job. Any other questions from, I guess we're still in Pulaski?
No, that's all. Thank you.
Russell? Taylor?
Yes, this is John Moore from the Central Kentucky News Journal. Can you hear me all right?
Yes.
Okay, awesome. I was wondering, I know that we're working a lot on social distancing. I've been looking at some models that have suggested maybe a 14-day shelter in place would be more effective at flattening the curve. Is that anything that's in the cards? I know we've seen that in California and other places.
Generally speaking, we don't want to ask everyone to have to shelter in place for 14 days. And, with this kind of disease, everyone shelters in place for 14 days. And then after 14 days, they come out and it starts spreading again. Probably the better strategy is to just slow it down so that not too many people are getting sick all at once. The ideal that we're going to be able to contain this Most people have given up that's realistic. Our best hope of containing it would be vaccinating people, and there's not a vaccine yet. So I know there's a lot of people feverishly working on trying to put a vaccine together, but until we get that, the thought that we're going to contain it is I think unrealistic. What we can do is we can try to slow it so that not too many people are getting sick at once and needing hospitalization all at the same time, thus overwhelming our medical infrastructure and making them less effective in being able to take care of who needs care. Any other
Right.
questions, sir?
No, that was good. Thank you.
All right, I think we're to Wayne, if I'm not mistaken. If I skipped anybody, Wayne or anyone I skipped, please jump in. Is there any of my staff who feel like something needs to be added to the conversation? Okay, not hearing any other questions, I want to thank you all. We will try to continue to have these news conferences weekly at this time, unless, of course, we are just too busy responding to something we can't do it. We would try to notify you. I did see one more question pop in. Is it true that those people that have had it and recovered have antibodies that could be detected with a blood test, making them able to rejoin the workforce? Dr. Wayman looks like she's going to answer that. I see her moving in.
It is true. Once you've recovered, you have antibodies and one could test for it. I don't know which labs at this point are actually doing that test, but I'm sure that'll be available in some near future, if not already.
And as
And
far as
you are also immune to being reinfected, at least in the short term. We don't obviously know long term at this point.
yeah, that's what I was going to ask. As far as we know, no one has caught it twice. And of course, it's not been around long enough to know the final answer to that. But at present, as far as we know, no one's been infected twice. Okay, I don't see any other questions. Dr. Wayman, I think you're sitting at the master control booth. Can you have someone there shut down the meeting?
I will. Thank you all for joining.
Thank you all.
Thank you.